A strong and committed locality structure offers GPs a real opportunity to influence local commissioning and address the current and future needs of patients in their communities.
We're lucky that we have a CCG that is so clinically led. We have 7 locality representatives sitting at the board level and strong localities led by doctors coming up with ideas about general practice for general practitioners and our patients. And actually we do have an opportunity to make a difference and a track record of doing so.
In other areas I hear that there's quite a lot of disparity between GPs and other organisations, and for example here we have a locality meeting once a month, and on that all the health bodies are represented, so we don't cut anyone out and try and do our own thing. We're trying to be really inclusive, and I think that's something that is unusual to our area. And what that means is when you start meeting people, you start forming relationships with them, and that actually much improves patient care.
If you're interested in service redesign, if you're interested in commissioning, if you're interested in having an effect outside of or at a wider level than just your practice, Gloucestershire's definitely the place to come.
You get to shape local services much more so than I thought would be possible. So what that means, for example, if something's not working very well for patients, you can say, hang on, this isn't working well, we need to change it really and make it better so that patients get better services. There's a good sort of track record, if you like, of cooperation, and that stood us in pretty good stead, particularly in more difficult times for GPs like now. We can actually get together and share experiences and that sort of thing.
As well as commissioning at a locality level, GPs here can use their clinical skills to improve the patient journey through care and work in a different way through the CCG specialty-based clinical programme groups.
We've actually split health into 23 clinical areas, what we call clinical programme groups. And each of these clinical programme groups is almost like a separate entity in themselves, so there'd be paediatrics, there'd be women's health, there'd be gastroenterology, and each of these is almost like a sort of department in themselves which are working with the community, with GPs, with other community services to morph things and make things work. And a lot of GPs have really welcomed that opportunity, and it's something they've been looking for a long time, to actually start to change things and make a difference. With the CCG, I've had the opportunity to work in various areas. One of the major areas I worked is children's services and understanding the commissioning and provision of children's services. And this has given us the opportunity to really look and sort of mould what's happening to make it better for our patients, but also better for us as clinicians, as GPs in the area. More lately, we've actually started to pilot a new service where we have a monthly meeting in the community with all members of our multidisciplinary teams. So we have the paediatricians, we have the school nurse, the health visitor, our mental health provider trust, and our GPs, and we look at our referrals with consent obviously from patients and families and just discuss them rather than having to make the child and the family slip up to the hospital and wait for the decision.
We are passionate about patient care, and what our patients think matters. Over the last 3 years, the National GP Patient Survey has shown significantly higher patient satisfaction with the overall experience of the GP surgery in Gloucestershire compared to the national average.
As a county, our biggest priority is to focus on recruitment and workforce planning issues, including promoting the county as a great place to live and work. For all the reasons highlighted in this film, we think this county stands out, so please consider coming to join us.